Hi everyone, my name is Kristen, and today we'll be talking about observational studies. Observational studies are research designs where investigators observe and analyze outcomes without intervening and manipulating variables. These types of studies play a vital role in understanding the relationship between risk factors and health outcomes. Let's explore three major types: case control studies, cohort studies, and cross sectional studies. A case control study compares people who already have a condition, called the cases, with people who do not, called the controls. Researchers then look backwards or retrospectively to identify possible exposures that might be linked to the condition. The main purpose is to identify potential risk factors. It's important to note this study shows association, not causation. For example, if we want to know whether smoking increases the risk of lung cancer, we would first select the cases, which could be patients with lung cancer, select the controls, which are similar individuals without lung cancer, then look back at smoking history to see if they smoked. We would finally calculate the odds ratio to measure association. In terms of advantages and disadvantages of case control studies, these studies are ideal for rare diseases, they're quick and cost-effective, and they're useful for hypothesis generation. For disadvantages, these studies can't estimate incidence, they're prone to selection bias, and there's limited ability to study rare exposures. A cohort study, on the other hand, follows a group of people over time to see how exposures affect outcomes. Participants are monitored over a long period of time to see who develops the outcome. This makes cohort studies powerful for understanding risk over time. Cohort studies can be prospective, looking forward into the future, or retrospective, using existing data. For example, to study the link between pesticide exposure and Parkinson's disease, researchers might enroll healthy individuals, measure exposure to pesticide use, then follow the participants over 15 years to track disease development. They would then compare incidence between exposed and unexposed groups. In terms of advantages and disadvantages, cohort studies can measure incidence and risk, they can assess multiple outcomes from the same exposure, and they're convenient for studying many diseases. For disadvantages, these studies are time-consuming and expensive, they're not efficient for rare diseases, and due to long periods of observation, there is a risk of loss to follow-up and bias. A cross-sectional study involves taking a snapshot of a population at a single time point. It measures both exposure and outcome simultaneously. There's no waiting and no follow-up. It's used to describe the prevalence of a disease or risk factor at a specific moment. Unlike other studies, cross-sectional studies are neither retrospective nor prospective. They focus on measuring prevalence and identify associations. For example, suppose researchers want to know, is there a link between smoking and chronic cough? You could first survey participants at one time, record the smoking status and presence of chronic cough, and then analyze the prevalence and statistical associations. This helps researchers spot associations without proving cause and effect. In terms of advantages and disadvantages of cross-sectional studies, these studies are fast and inexpensive, they're useful for public health surveillance, and they can help study multiple exposures and outcomes. For disadvantages, these studies cannot determine cause and effect, they cannot measure incidence, and they're not suitable for rare diseases. In summary, observational studies are valuable tools in medical research. While they don't prove cause and effect, they help researchers identify patterns that guide future experimental research. For more information, visit our website at www.phactMI.org.